So I think I'm going to stop there, and we're going to go to discussion.
Thank you very much, Mike. That was very, very illuminating. Enjoyed it. I hope the sound quality is good for you all. If it isn't, please feel free to send me a message and we'll try to fix them. So the question that we have come to us is, what do we do with VPNCs, Mike? What are you suggesting? What strategy are we supposed to take in the future? That's a question that comes from Michael Monk.
Well, we learned about this strategy from old microbiology. This is the process of tyndallization. Before we invented autoclaves, we would do to prepare culture media, we would boil it, allow it to cool, and then effectively reboil it again. And we effectively were allowing the populations of spores, in this particular case, to germinate. And what I'm making the argument for is we really need to do clinical trials that ask the question, can we change up our antibiotic script and do the heretical thing of not having continuous exposure of the patient in antimicrobial, but starting and stopping to allow the VBNCs to effectively come out of their viable but non-culturable state, so you can effectively add the antimicrobial, and then it's a process of dilution. At any moment in time, you're going to be generating a VBNC population. Once they begin to grow again, they're susceptible to the antimicrobials. And while they're growing, and again, antimicrobials always work best against actively growing bacteria. And so you knock them down and then you stop the antibiotic. Now, the argument is we're going to breed or select out for resistant organisms. And again, here, understanding the resistome of the community there often will inform us of the best antimicrobial cocktail to provide to that population to winnow it down to a concentration that the immune system can then deal and get rid of the remaining bacteria.
Thank you, Mike. I hear that the echo is pretty bad when we use the room. Hopefully we'll get this thing down, sorted out by end of the day today. Next, I'm going to actually ask Karan to get his presentation ready to give us a talk in a second. But Nick Shami asks a very good question from UCLA, and I'm going to answer it because I think the echo is so bad. I'm not going to ask anybody else in the room to talk for now. The question that comes up is this differentiation between microbiota and pathogen. A very good one, Nick, and I think we're going to cover that topic in a few minutes when there are multiple other talks. But one of the issues with the molecular techniques is that it detects the DNA or RNA of pathogens, and we need to be able to distinguish between pathogen and normal commensal or microbiota. This is where Microgen DX has designed the incorporation of molecular markers, biomarkers in the synovial fluid and other sites, as well as we have Dr. John here, who will talk a little bit later about the virulence genes, which would be able to address this issue. So for a patient to be able to, for a pathogen, for an organism to be a pathogen, it needs to create enzymes or produce enzymes that would harm the host. So by definition, we should be able to see some of the enzymes that are harmful. So we're going to talk about that fairly soon, but that's a great question that comes up.